and joins us for details this morning. A very good morning to you, Lorenzo. Perhaps let's start with a recap of what happened yesterday and what we heard from the Deputy President.
Well, Dudu, this summit has been dubbed as the Codesa of the healthcare system, where over 600 delegates that you've mentioned have really putting their heads together to find out what can be done tangibly so to basically deal with the crisis that is plaguing the healthcare system. The Deputy President yesterday was quite thorough in his address to this summit yesterday, saying that the healthcare system is in an ailing position. I mean, one of the things that he spoke about was the fact that there's obviously shortage of staff members, there's a shortage of drugs, talking about how there needs to be tangibles that are going to come out of the summit to address how technology can assist in improving the lives of people who are seeking health services in the public sector. And of course, the one thing that the Deputy President did touch on was the skewed distribution of the finances in the healthcare system, saying that a big chunk of it, Dudu, is going towards private healthcare, and that is only catering for 16% of the population, saying that this needs to be addressed. And this is why he and a lot of the speakers yesterday were talking about the importance of ushering in the national health insurance. We know that that is going to take place next year. And of course, the Minister of Health also indicating that although there's a lot of naysayers about the health insurance, they are quite sure that if all the hospitals across the country are equipped to meet the minimum norms and standards, that the NHI can indeed be a successful endeavor, a very ambitious one at that, where South Africans are going to have access to quality health care, and this is not going to be determined by the money in their pockets.
So plenty of challenges facing the health sector. This cannot afford to be another talk shop. Lorenzo, what to expect today?
Absolutely. One of the mentions is how the NGO space has been quite vocal, even just on the first day, Dudu, saying that they are quite doubtful that just 2 days is going to be enough to address decade-long challenges that have been plaguing the healthcare system. In fact, speaking to the Treatment Action Campaign, they're saying that they'll be quite satisfied if in a couple of days after this summit, where there could be an announcement that all frozen posts across the country in all the various hospitals could be unfrozen, so that people could be hired in the very critical positions where there are vacancies, saying that it is due to this that there is all these ailments that are plaguing the healthcare system. And of course also the Progressive Forum that is made up of academics as well as people in the NGO space and so forth, telling me yesterday, Dudu, that they are quite concerned that this summit is starting to look like it's another talk shop about the national health insurance, saying that everyone is on board on the national insurance. They need to now look deeper and have more foresight into what exactly is plaguing the healthcare system, which has been described as critical. So today we are expecting a report back from the preliminary commissions that have been taking place. We know that even the Health Ombudsman has been chairing some of these commissions. We are also expecting a way forward and, of course, closing remarks by the Deputy President himself, and that's only going to be happening at around 4 o'clock. So we are expecting a thorough sort of like report back as to what these little commissions have agreed on, what is a way forward, how is the country going to work out what has been described as an ailing and a failing healthcare system.
A very important portfolio that deserves all attention. Thank you very much to my colleague Lorenzo Temba out at Birchwood Hotel in Boksburg for us, attending, of course, the Presidential Health Summit.